Permission?
Absolutely.
Proceed. Gentlemen of the Dauphin County Board of Commissioners, good day. I sit before you today not just as a concerned citizen, but as someone who has delved deeply into the challenges. I originally came back to government lured by the prospect that I could conduct a whole-scale review of the mental health system to include recommendations. I was asked to do that. That was my only reason I came back, as that review was needed. During my tenure as Assistant Solicitor for Dauphin County, I was privileged to gain a unique perspective on the state of mental health services within our community. I visited with 32 people to gain a deep understanding of our county mental health system. I finished this gathering of perspectives while I was an Assistant Solicitor. I did not set pen to paper at that time. As Chief Solicitor, I did not have the time to set pen to paper either. My wish to complete this whole-scale review did not come into full fruition until after I left government service. I had spent so much time getting to the roots of what we as a county did well and discovering our opportunities for growth that I could not simply let it go. To let it all go without a final report would be a sin. I had interviewed so many people who all cared very deeply on this issue that I again could not simply walk away. Over the last 10 days since I left government, at a pace of full-time occupation, I've dedicated myself exclusively to composing this comprehensive mental health system report for Dauphin County that sits now before you. This endeavor was undertaken independently, without any cost to the county or its taxpayers. It represents not only my observations, but also the collective insights of professionals, patients, and families engaged with our mental health system. This report is unvarnished. It does not shy away from hard truths. It does not gloss over the shortcomings we face. Instead, it seeks to highlight them, not out of criticism, but out of a fervent desire for improvement. I present this report to you not as an indictment, but as an invitation to understand, to engage, and to act. I'm well aware of the cynicism that often greets such endeavors. There's a voice in my head that whispers, you and others may never read it. That I and the 32 people who worked on this project wasted our time. But today I issue a respectful challenge to all to prove that voice wrong. Because within these pages lies not just a critique, but a roadmap for transformation. Our mental health system is at a crossroads. The challenges are significant, but they're not insurmountable. This report offers practical, real-world recommendations that goes beyond mere identification of problems to pose solutions that have the potential to make tangible, positive impact on the lives of Dauphin County residents. These recommendations are born from a deep-seated belief that we can do better, that we must do better. They are informed by best practices, innovative approaches, and the hard-won wisdom of those who live with, work in, and navigate our current mental health system every day. I urge you, as our elected representatives, to give this report the attention it deserves, to see it as a valuable resource on your ongoing good efforts to serve the people of Dauphin County. It is a call to action, not merely admiring the problems that we face, but to embrace the solutions that can lead us to a brighter, healthier future. In closing, I ask for your commitment to not just read this report, but to engage with its contents actively, to question, to challenge, and ultimately to act. Together, we can forge a mental health system that truly serves the needs of all of our constituents, and one that we can be proud of. I'm available to come to any workshop meeting and present in a concise fashion the recommendations. I will do so without any cost to the county. It is a free will offering. Please do not let known, identified, and easily solvable problems persist. Thank you for your time, and I look forward to any response.
I'd be glad to first entertain. Thank you. From my perspective, this reminds me of the 2017 report that took a look at the engagement by the Council of State Governments of our how we treat individuals who have serious mental illness in our county jails, with the clear purpose to attempt to reduce the length of stay, because it's clearly known that folks who have mental illness stay longer and have more challenges being able to be treated. And unfortunately, after the closure of the state hospital, our state jails and our county jails have become the #1 provider of mental health services, and we've got to do much better than that. The idea of now taking a look, and look, vast improvements need to happen on all levels, but having a roadmap and the ability to make clear recommendations that also involve court process, because I think that's a critical component in this piece. Oftentimes we focus just on the service delivery side, but this is a comprehensive issue that affects almost every system within Dauphin County, and I know you've taken a look at that, because I know how you and I talked post-pandemic with a personal situation where folks were in hallways of emergency rooms waiting for days to be able to get access to inpatient treatment. And quite frankly, our system is broken. So from my perspective, anyone who wants to play a willing hand and has the sort of expertise that you've been able to provide in examining this issue in depth and being able to work along with the courts to be able to create a solution, it is a welcome roadmap, and one that will be received well, analyzed thoroughly, and followed up on, and I will personally be in contact with you about the level of engagement we need from you for its implementation.
Thank you.
Thank you.
I echo the concerns of our criminal justice system. As prison oversight and speaking yesterday to the senators, one of the statistics I shared is that we have 16% of our prison population currently on suicide watch or mental health watch. 44% are currently on psychiatric meds of some kind. We are criminalizing mental health, and it's unacceptable. On top of that, setting matters when you're trying to get someone into a mentally healthy state, and the setting of a prison is not the space in which mental health is going to, in my estimation, get better. And so treatment should be taking place in a hospital setting, not a prison setting. And so there's definitely a lot of opportunities. You said there's recommendations in this report?
Yes, sir.
Like solutions? Okay.
14 of them that cover the entire spectrum, from low-hanging fruit that can be done immediately. Two of them I solved through my time at Dauphin County immediately, that had immediate impact. The 12 that remain require further additional discussion and action. And out of the ones that remain, there is only one that is unsolvable in my opinion, that has to do with the bed space issue. But I did have recommendations talking to the stakeholders of how we can develop a no-cost system to more efficiently move people through and have higher occupancy rates. There's statistics in there about the various CRR programs and the habitation options short of full commitment, and how we can streamline that and move the occupancy rates from 70% to 90% very quickly. It's a massive document.
Sure. Can I ask, when you came on as assistant solicitor, you were under the impression this was one of the primary tasks that you were tasked with?
May I be blunt?
Sure.
It was the only reason why you got me out of my couch.
Okay. You said you talked to 32 people,
Yes.
some of those county employees, I assume?
There's a table, if you care to
okay,
see,
sorry.
that has, I know, this is dropped on me.
No, that's okay.
If you care to see, there's a table that is attached in the index specifically. It would be list of people consulting contributors on page 70. That lists the 70 people that I had formal meetings with. There were also patients that chose not. I met with, 50 patients, family members that were also end users. They decided, because this was going to be a public document, to not have their name included
Yeah.
for privacy concerns. The people that are listed on page 70 are excellent people. They welcome these recommendations, and they are a credit, and they go from everywhere, every traditional silo, if you want to put it that way, in our system, from DA's office to public defender's office to the prison to intake to probation and parole to crisis to CMU to the judges to the mental health review team, from crime care, also the Connections Health Solutions. It is anyone who would talk to me, and everyone would, that I asked for. And I also went through and said, who else should I be talking to? So I listened conservatively for over 100 hours of my time as assistant solicitor trying to get to 136 pages.
Good morning.
Good morning.
I think we can all see and hear the passion in your presentation this morning, and I'm not surprised by this document and the thoroughness of it. I've seen you in action. I will, of course, defer a lot of this to Commissioner Hartwick, who has oversight of human services, which includes mental health, and our newest Commissioner Douglas, his passion for reform at Dauphin County Prison. We go back to the state making that short-sighted decision many years ago to close the state hospital, which they realistically should have just renamed Dauphin County Prison. It's unfair to the corrections officers there and staff. Mentally ill people shouldn't be in prison. That's a lose-lose proposition over and over again. And I appreciate my colleagues both working in their various oversights. It's going to be a long process, and we need to work together to find that solution. So thank you for the amount of time and effort you put into this work.
And last I saw one of the recommendations, you said two of these in here, there's also a CMU director as well. That's
Correct.
Slatter.
Very good. That's new information to me.
Yeah.
That must have happened very recently.
Probably in the last 2 months.
Okay, that's fantastic.
Thank you.
All right, you bet.